So I'm really excited to have you guys in Austin. Well, Vince, you've come to Austin. Ameet, we see each other periodically. But there's something more that sitting here, there's a whole philosophy that binds us together, I think, and it's different. And I'm so excited because I've always felt really alone in dentistry. Like I was the only one waving this flag, and I think you felt the same. And I think when we met Vince, it was the same for you. So maybe we should just explain what kind of binds us all together. What do you think, Vince?
I think it's our pursuit of the truth and the root cause of your oral health and your overall health issues.
Would you agree?
Absolutely.
Yeah. And for me, I'd take that in the preventive. I know you're all about maybe slightly more focused, let's put it that way, on treatments and what to do for patients, and you won't do it until you've figured out why they need them. I look at their problems, decay, gum disease, and it's the same thing. Why do they have that? Is it their saliva? Is it what is going on? Why has this occurred? So,
well, prevention and my focus is root cause, the root cause of everything. Before I enter into a treatment plan, I have to know why we even got to this problem before I can formulate a plan. So root cause prevention, I think, is synonymous.
I agree. I agree. And doing it soon enough. I mean, I think I heard you talking to Vince a little bit ago when we were setting up that you're excited about treating children now. Now, why? I want to treat pregnant women because I want pregnant women to start using Xylitol and the techniques and strategies that I recommend so that they'll know how to do it is one, but they'll then have a baby with a healthier mouth and so on. You can't start too early. And I think that's one problem in dentistry, don't you? That we sort of, it's so impersonal. You wait, almost everyone's looking and waiting for a cavity to form.
Yeah, it's interesting, actually, in healthcare in general, and I've noticed this as I've continued my career into the Airway division, is healthcare has siloed all the practitioners. So you have your general dentist, adult, then you have your pediatric dentist, general, and then we have medical doctors of every division, but they're all separated or siloed. And so there's no communication between them. So how can you work as a village? How can you treat this entity as this person? And they have multiple things going on. You have to corroborate. You have to have a quarterback. You have to see the entire play. And if your quarterbacks are all in separate rooms and they can't talk to each other, can't see each other, they can't see what's happening on the field, you're going to lose that game. Absolutely.
And I think we've also talked about dentists being trained by mentoring with somebody who's already been through the sequence. I mean, somebody who's had 30 years in practice, get a new graduate. Do you think they're going to tell them things that blow their minds?
Absolutely. That lost practice of mentorship and apprenticeship is lost in all areas of work, but especially when you're treating humans in medicine and dentistry. If we could recapture that, because a lot of the questions I get from patients, I'm sure Dr. Ameet does as well, is why is this happening? And although the silos have benefits, the silos will leave gaps in knowledge between the individual practitioners that I think all of us here today are trying to fill for the audience.
Absolutely. I mean, I think pediatric dentists, I was a general dentist before I became a pediatric, for 10 years before I became a pediatric dentist. And I looked at pediatric dentistry very differently because I know what's going to happen 10 years along. And I think, correct me if I'm wrong, but in America, most pediatric dentists get out of dental school and decide their specialty and then go straight into training. And so they become pediatric dentists. They don't know. They think they put the mouth in great condition. But what happened to that sealant? What did it do? I mean, did that child grow up then with gluten intolerance? Is there a connection? You can't tell if you're not aware of the whole health of the person, what you've done, and the long-term consequences.
And right? I think that's where the lack of community of dentistry is very apparent, because if these pediatric dentists had more of an affiliation with general dentists, they would see the consequences or benefits of their work down the road.
100%. Yeah, I agree. And on that sort of theme, I think we have to talk about crowns, the dreaded crowns.
Jumping into the fire pit, are we?
Let's just jump in. So, Ameet, I know you feel strongly about crowns.
Yeah, I mean, people have to understand that crowns there's a prescription that dentists have to dole out. So we have a problem, we have a solution, and one of those solutions, we prescribe a crown. Throughout the history of time, 1900s is when the crown showed up, and the crown is still there, and it's the dominant prescription. Any pharmacy has multiple prescriptions, right? And so why don't we? And then that's my major thing was what I sought out, how to learn how to prescribe treatment. We don't learn that in school, a little bit, but we have very few prescriptions. It's hammering everyone with the same prescription. That's just not a good way of treating people. So once I found out something called biomimetics, it allows you to tailor the prescription to each individual's situation. So now I have a plethora of treatment options that never existed before. So I'm not anti-crown, I'm anti just writing the same prescription over and over again.
So just so people who don't maybe understand what that means, you're saying that sometimes you don't have to just cut the whole tooth around to put a crown on it. You could patch, would you use the word patch?
Rebuild the existing tooth back to its original structural dimensions, instead of obliterating the entire thing and giving another material and putting it on top, right? So that was the original crown, and it still is the exact same thing as it was in the 1900s. The materials have changed, but the philosophy and the ideology has not. Yet technology and understanding has all evolved, but that treatment has not.
Do you agree?
I agree. To add to Dr. Ameet's point, crowns are not bad. There's too much social media influence now saying crowns are bad. However, a crown is not a crown, is not a crown. There's different variations of how much tooth you take away and how much tooth structure you leave. And me and Dr. Ameet have very similar training in biomimetics. And I think a one-size-fits-all crown could be over-treatment for some people. So you can have a crown that takes away less tooth structure, still called a crown, but it's more of an individualized prescription for that tooth.
Cool. Yeah. Now, on the topic of biomimetics, you're not on the website. I used to send people to the website, and they weren't always thrilled with who they got. So can we talk a little bit about the caution in looking for biomimetic dentists? I mean, what should somebody ask the office? Do you have a feeling if they're looking for someone like you guys?
Maybe you agree with this as well. Just where did they get their biomimetic training? Because biomimetic now is such a hot word and it's trending on marketing that I have patients that go to biomimetic dentists that have no biomimetic training. They just use that word for marketing.
I know. It's really sad.
I think it's very difficult for patients to choose a dentist in the first place. And you can see all the Google reviews, and you go in and all of a sudden it's a completely different place, as if those Google reviews were faked. And I've heard this from a lot of patients. You just don't know what you're going to get. So I try to break it down to two areas for patients. You have the corporate dental model.
Absolutely.
That's owned by a corporation, run by a corporation, and there's no individual single dentist overseeing the entire process. You're going to get a different product. That's a different level. Then you have your private sector where you have a actual dentist, maybe their name's on the door like mine, and like, Dr. Vince's, that individual not only owns it, but they run the entire place. And so it just makes sense. If you have one spot, you're going to have higher quality, you're managing less. But if you have 5 offices, the quality is going to take a hit there.
I think you speak about these sort of big box managed dental facilities. Do you agree with all of that?
I agree. I do want to say real quick to Dr. Ameet's point, a biomedic dentist is trained differently. However, if you have a traditional dentist, it does not mean they're a bad dentist. I think patients, you need someone that cares about you and is looking for the root cause.
Experience and caring.
And empathy.
Empathy and caring for why you're there.
And sometimes these corporations set up these young dentists in a position where the actual structure of how the practice is run doesn't allow the dentist the time to truly find the root cause of your problems.
I think they don't at all. And I think they even make, I'm told, I don't know, have you ever worked in one of those?
I have worked.
Yes?
Yes.
You had to perform a certain number of treatments in a day or a week or.
And sometimes, like Dr. Ameet mentioned, your boss has no education in anything health-wise.
How long did you survive that?
I think I did it for like 2-3 years. It's I mean, when you get out of school, you don't know any better. And then you walk in and you're so excited to practice dentistry. You're like, this is exciting. And so you don't really notice the red flags that are flying everywhere. You know, you're just like, okay, I'm going to go. You're just so excited to do it. And after a while, unless you're deaf, dumb, and blind, you'll start seeing things that do not go with your ethical standards. And either you continue to push through it, and I know every dentist who's gone to the corporate model has to experience this, unless they live in some utopia. You start pushing your ethical boundaries over and over again. Eventually, you're like, I just can't do this, and you leave. So I usually, like 2 to 3 years is kind of the average.
Did you have that same sort of thing?
My ethics weren't pushed. My problem was I had trouble working for someone else. And if I'm not, like Dr. Ameet saying, in control of the quality and the protocols and overseeing the vision, if I'm not the captain of the ship, I'm not a good mate.
Come sit here.
Yeah, I know.
That's more of a personality issue
That's
than
more
anything.
of a problem for my therapist than for a corporation, but it didn't fit my
No,
personality.
it's true. Well, I had that trouble working in, the University of Rochester. It's in everything. I saw what we could do my goal is so that we can eradicate caries, tooth decay. And I saw a possibility to do a study and prove that. And when they would not fund the study, what do you do then? You know that the people you're working for don't have that as the goal. And if your goals are different, it's very hard to be within that community, right? I mean, it's not that they're wrong. That's not their goal. Their goal is to provide treatment for patients. My goal was to provide the elimination of the need for treatment.
Mm-hmm. But now then you're messing with someone else's revenue stream and their income.
I realized that. So I had to go out on my own and do my own thing and find that in America, it's really difficult. But do you find difficulty making enough revenue? Honestly, I mean, that's a pretty challenging question, but.
No, my business model is different than the industry's business model. Mine is to provide honest, true, real care at all costs, regardless of what. That's the number one for all my patients. And that's been profitable for me. So my philosophy is profitable. Now, if I put profit as number one, I'd still make money, but at what cost? At the cost of my internal being. And that's just, there's nothing worth selling my soul. That's just my personal belief. And also when healthcare can be profitable, and to say that it can't be in certain ways and certain models, it's just not true. I mean, you can really give great care, the highest quality care, and be profitable.
Who does the education in your practice? You?
My whole staff, me, my staff, everybody is fully educating our patients. And we spend so much time on education. And, whatever the issues are, like I said, I love to go back and explain to the patient or even investigate with the patient, where did this all start? Because I want my patients smarter than any other patient that ever existed. And actually, I think a lot of my patients have more knowledge than majority of the practicing dentists on this planet.
Supposed to say that slowly and quietly.
I have no problem doing it, because an educated patient is end up going to make really good decisions. When I'm not around, they can make their decisions. My goal is, the Latin term for doctor is teacher. If I'm not teaching them and educating them on how their health works, what they need to do, then I don't feel like I accomplish my goals as their doctor.
100%. Do you agree, Vince?
I totally agree. And to go back to Dr. Ameet's point about being profitable, I had to remove myself entirely from insurance, which is a whole different topic. But I think once your dentist or medical provider opts out of insurance, it gives the dentist or doctor more freedom to treat the patient as a person, not as a number.
What would you tell somebody who doesn't have a lot of money and, is scared of that? What would you say to them?
I understand. It is scary because medicine's expensive, dentistry is expensive. But if they're going to look for treatment that addresses them holistically, it has to be, at least for my skill set, without dental insurance.
So would you say to them that maybe you're having the treatment now, but that's going to change your outcome in the future?
I do try to say that lack of health now is very expensive down the road. And if you can't buy health later in life, you can do more preventative measures now, but the cost you pay later, and this is in all facets of life, if you take the shortcut now, it actually costs you more down the road.
I think so. So we're saying that taking important steps with a kind of ethical, caring dentist now is going to help you down the road not to have the problems that if you do the cheap road or the insurance road with the wrong dentist that is inexperienced, you might pay for that later in life. And that's kind of what I tell patients, or used to tell my patients, let's get your mouth healthy first and then do the treatment. And then it will be a one-time treatment plan. Because I don't care how good your fillings are. If the mouth is full of disease, they're not going to last. And I've had cosmetic dentists who didn't believe me, brilliant cosmetic dentists who thought that their work was so good, it was going to last. And it took them 25 years. I mean, most fillings only last 10 years. And I don't think people realize that. They think of fillings the end of the story. It's the beginning of the story, right?
Yeah.
Because that single surface filling at the age of 17, by the time they're 30, is probably a 2 or 3 surface filling. And then we get into the crown,
root canal, implant.
root canals, implant. I mean, I know in, budgeting for retirement, my financial guy is busy telling me, you're going to need to save extra money for dental. And I'm like, no, I'm not. But I think the majority of people have to save up because that's the most expensive time of their lives because their teeth are falling apart. And I'm not sure that pediatric dentists realize that. They put on a sealant when maybe it didn't need a sealant. And that sealant then created caries around it. If they didn't do anything about education, they're not helping.
Yeah.
They're really not helping.
It's more of a
it's helping them.
Symptom-driven process. Like Dr. Ameet always brings up, they're not addressing the other root causes. And then it's nothing against the pediatric dentists that are placing sealants, but I think if patients were more educated on diet, mouth breathing, the holistic approach to their mouth, then people would be less frustrated with the dentist. Because Dr. Ameet knows this, we're not loved. It's us lawyers and the IRS that people don't really love. But if they felt,
you guys are different.
if they felt more empowered, we wouldn't be on their hit list for people they don't like.
Yeah, I agree. But I think it's this very delicate balance between helping your patient understand and what the patient's already been brainwashed into believing. I mean, I think most of the questions I get on my TikToks and YouTube are, okay, so what toothpaste do I need? And I tell them, you've got to go to my website and buy my book and take the course. And they're like, no, what do I need? And it's taken me a while to realize they are looking for a toothpaste to fix everything. That doesn't exist. I don't care what you're using. Even the toothpaste that I recommend doesn't fix everything. If you have no caries and no risk, it'll keep everything, quietly moving along. But if there's no panacea for these diseases, right? It's lifestyle. It's everything. And I know you get into diet a lot with your patients, right?
To their dismay, I do. I brought this up at dinner last night. If it's in God's garden, if it walks in the garden, swims in the garden, grows on a vine, grows on the ground, not artificial, it's good for you. If it's made in the laboratory, if it has 0 calories and tastes amazing, some scientists manipulated it for you to eat it. And I really think you have to look at food as well. Food is a major component to your oral health.
Well, I think there's the direct impact. I'll let you talk about drinks and sipping and snacking, but I also, because I work with a lot of older people who have periodontal disease and they don't want to have the deep cleanings and everything. And I say to them, they have got to work on their digestive health, because if their digestive health is messed up and their nutrition is messed up, what circulates around their body are toxins and not helpful nutrients, phytonutrients. And I think most people are shocked that what you eat, say you have a really healthy lunch, 1 hour later, 60 minutes later, those nutrients actually will diffuse from the blood circulation into the salivary glands and then pump into your mouth. So 60 to 90 minutes after a meal, if you ate high nitrate foods, vegetables, salads, celery, beets, all those things, you can actually measure it in your mouth 90 minutes later. That's wild.
Mm-hmm.
I mean, we don't think about that. And if you're sipping and sipping and sipping your coffee for an hour after a meal, none of that stuff is going to happen. And I know you tell your patients the sipping dramas, right? You're snacking, sipping.
Yeah, stop stuffing your face. You just really just enough already, all right?
You said how it is.
So I have a problem with that because I use food as emotional support like everyone else.
Mm-hmm.
So what would you tell your patients to say, I have such a trouble stopping snacking?
We got to figure out why are you continually snacking throughout the day. I mean, do you have pre-diabetes? Are you just thirsty? Or do you have, some sort of neurological something that's causing you to constantly do it? Because a lot of times our body is just giving us signals for something else.
Mm-hmm.
It's not like you literally are starving to death. No, I mean, humans don't have to eat every day. We were designed not to eat every day. We have that ability. So something else is going on metabolically, psychologically. I'd rather go to that root cause. And if someone's not open to enter into that realm, then, they're not ready for this level of care, and that's okay. But there's always a reason for that.
Mm-hmm.
I've had a lot of success with explaining this 60 to 90 minutes, what it's doing in your mouth. So that when you've had lunch, if you finish with a tooth protective food, I'd recommend xylitol, of course, and then you mouth rest. This term is mouth resting. In other words, you give your mouth the opportunity for an hour. It's going to remineralize your teeth. It is. And immune cells are going to be in your saliva, potentially helping your gingival health, your gum health. And then at 60 minutes to 90 minutes, you're going to get these nitrates that actually feed the bacteria that produce nitric oxide. And not everybody's heard about nitric oxide yet, but basically that helps your heart circulation, your breathing, and your cognitive capacity. So if you give yourself 90 minutes after lunch where you don't eat and drink, just be aware after an hour, are you feeling like I feel better? My mouth feels good. I'm actually able to think really well. And I really think once you've experienced that, you start to like it. And then package your whatever you're eating and drinking into meal times more. And this whole thing of water drinking, I know we have talked about that last night too. Go ahead, Vince.
I just have to bring this up. I went to school in the 90s. Nobody had a water bottle in class. And I have 4 beautiful daughters. I love them very much. But they all bring their fancy water bottles. They go into class. And my kids' age, they're between 8 and 4. They can't go to school without water bottles. And they're sipping water all day. And like Dr. Ameet, you just explained, our bodies weren't designed to have little sips of water all day. There's another issue going on that is trying to treat, or that there's a reason for why we're doing that.
Well, kids are being taught that now, right? And then there are some of these water bottle companies, I think, that are actually promoting it,
Mm-hmm.
that you would drink more. There's this fine balance between drinking enough and this sipping constantly that is, to me, pathogenic too. It
I would
doesn't make any
argue
sense.
our bodies are designed to tell us how much water we need. I think the 8 glasses a day has been proven to be a myth.
Yeah, a myth from the 1930s.
Maybe a scam by Big Water, but I really don't think you need 8 glasses. Like, your kidneys have a really good job of regulating your minerals, unless you have other pathology within your body.
Yes. And again, you've got to take into consideration what sort of foods you're eating. If you're eating I remember the first time I ate Kentucky Fried Chicken, I was so thirsty afterwards. Very salty foods.
Yeah.
If you're going to eat something like that can create more thirst. So I think the whole thing is a cycle, basically. If you begin with the good foods, the real foods, you drink in these sort of sessions rather than sipping, and you have this intermittent period between meals where you're not eating and you're not drinking and you just leave your mouth alone. It's very different. And that's how it used to be, right? Do you eat and drink during your workday?
No.
I have my green tea in the morning and I rip it through the day. I rarely really eat on anything other than a handful of pecans. And that's my entire day, and it's been that way for like 20 years.
Yeah. Yeah.
You know,
So I think that, different ages, different stages of life, but I do think the sipping and snacking is creating part of the problem, right? That people are struggling with their mouth health.
Absolutely.
Particularly if you've got Sjogren's or some, I mean, I work with Sjogren patients and I put them on the same regimen. I tell them, you are not going to die of thirst. Your mouth will feel dry the first time you do it. The second day, you probably find your mouth feels better. And I've had Sjogren's patients come back and they've actually felt saliva come into their mouth when they stop sipping water. It's almost like if you keep sipping water, your body gives up making saliva.
Oh yeah, almost like you become now addicted or reliant on this constant external water instead of your mouth producing saliva.
Yeah, totally.
I mean, adding to both of those, people don't realize where we got a lot of our water from was actually from food. So before big water and all the marketing and everything that started, our bodies followed a certain rhythm. We were getting a lot of our water from fruits and vegetables.
Sure.
You know, and then the occasional pit stop at a watering hole. Most of our water came from that. And then also we were very good at conserving water. And so as we moved into more modern times and we lost that connection to the original programming of our body, the original way things were. And so people are now went from consciously choosing foods and water to unconsciously just taking in without thinking about what does my body need? What does it feel like? Am I actually thirsty? Am I actually hungry?
We're training our kids to do that.
Yeah.
I mean, it's one thing if you're in an athletic environment. I mean, I'm all not critiquing that, but I mean, if you're just sitting all day, why do you need to sit with a water bottle? I don't understand.
And I think to add to Dr. Ameet's point, if you look back to hunter-gatherer times, and this is popular when the paleo diet was popular, if all these people did not have all the chronic diseases and chronic dental diseases we have now, the question is, well, what are they doing different than we're doing so we could replicate their health?
Yeah, I mean, I do think one of again, I believe we talked about it a little bit last night, is this thing that the world has changed. People want me to give them an equally effective system without the colors and without the chemicals. Well, I guess if I made my own system, I might be able to make it without the colors and some of the additives in the products that I recommend in my complete mouth care system. But the problem is, diet alone, probably for most people, is not going to cut it because we get infected by just living in the world we live in, where this disease is out of control. In America, it's pretty much out of control. Now, there are countries. In Denmark, the average person has a quarter of a decayed or damaged tooth per person. A quarter of a tooth per person throughout life. What you guys going to do then? Nothing. Finland has had the Xylitol program now for over 60 years. They give it out in preschool. Their dentistry is very minimal. So in America, the average, we're 12th on the laundry list of countries. Do we want to make people healthier? Are we really committed to it? It's a tough question.
We want to. All three of us here.
Three out of the entire population of healthcare. Sure.
I think there's very well-meaning doctors and dentists who want to make people healthy.
Nice,
absolutely.
Super nice people. But the training isn't geared for prevention, right? And
absolutely not.
So the public has to figure that out for themselves. If they don't want to have cavities and problems, they need to become educated before they do anything. And I want to take us into the orthodontic world and the world of extractions now. So
let's do it.
Go ahead.
To put onto that point, I was going to say that people have been indoctrinated into being unhealthy. Meaning, so when a kid's certain age, I got to get braces. Like the parents are already planning to get braces for their kids. It's already kind of like, we're going to save up for college. We're going to save up for braces. They're indoctrinated into this, accepting that this ill health is normal. We've normalized unhealthiness. And now we've made an entire industry out of it. They either promote it and then we fix the problems of being unhealthy. And braces is a very good example of just it being so normalized instead of someone just going, wait, why is everyone's teeth messed up? Has anyone ever Just ask the question. And the funny thing is, going through dental school and I accepted it. I never learned once why were the teeth we're getting malocclusion, bad bites. Why? Never addressed in dental school. And as a dentist, I only learned this about 5 years ago, 15 years of my career. And I consider myself a voracious reader. I'm always looking for things. I never found out. No one ever said, oh, hey, and this is why, until I got into Airway. And I'm like, it just was mind blowing.
Well, it all begins, right, with when you breastfeed, the suction brings the palate down and starts widening the bone structure to produce a better airway. I see a lot of pressure to make it difficult or disencourage women to breastfeed. And it was when I was in Rochester back in, I think, 2012. They came out with a study, breast milk causes cavities.
Oh, my God.
Impossible.
Yeah. No, it did. And when you looked at the study, because I actually went and read the study, which is what I do when I see these media reports that are like, what are you talking about? I'm a mom of 5, okay? And I had 8 grandkids, and they all were breastfed, some of them for years. What they'd done was they did a study where they took sugar as how much decay these rats had if they were given sugar. Now, I have to tell you, they took out their salivary glands, so they hadn't got a hope of not getting decay. So these desalivated rats, sugar was given, the amount of decay they got with sugar was given a numeric of 1. Soda drinks with the phosphoric acid and everything else was higher than sugar, which doesn't surprise you, but it surprises some people because soda, even diet soda, is so damaging. So that was on the scale. Milk, whole milk, was actually chirostatic. It actually didn't cause any decay at all. Good whole milk, which doesn't surprise us. Breast milk has a little bit more sugar in it. So there was a tiny, tiny increase, but minimal. What is the headline of that? That breast milk causes cavities? Yeah. No. I mean, the real thing was that diet soda is really damaging to teeth, but that's not how it was reported in the local newspaper. And I actually went to the researcher, and eventually it was rescinded. But it was funded by
Nestle,
Abbott, who make baby formula.
So Nestle is actually invented the majority of the baby formula, and it started around Industrial Revolution when we're actually the World War I, and all the men were going into war, and so the women had to make the weapons of war, and that was kind of like when women started going into the workforce, and they had all these babies, and they're like, well, what do? We can't just breastfeed and work and stuff. So Nestle came up with baby formula, and that's when we started moving people into baby formula, into bottles. It's just in mass, and then when that happened,
that was my era.
They made money off of it, and they're like, hey, why don't we just be okay with this? So then doctors are like, you know what? You don't need to breastfeed. And that's when it first, but before that 1900 point, World War I, breastfeeding was pretty much on average between 2 to 3 years.
Yeah.
And we did not see the malocclusions, but it was after that incident when it just, you follow generations after that.
The nipple of the bottles, when I had my kids, even they were like a straw, basically, or a great big open.
Let's just go with the fire hose on this, because even the nipples today, that if you're not going for the ones that are low flow, you just get a standard nipple from 2024. This thing has 3 to 4 times the volume in the same time as an actual breast nipple. So I can only imagine back in the day, it was probably just a straight fire hose.
Just a fire hose, absolutely. So, I mean, in England, my mother was told it was much better for her baby to have formula. I mean, that was the belief. Mm-hmm. So I probably have a reduced airway because I'm sure I was bottle fed very quickly after I was born.
I find that study very frustrating because what they leave out is that when the mother breastfeeds the baby, the saliva from the baby is information to the mother, and the actual composition of the breast milk changes based off the baby's needs. So you have some form of intelligence that is feeding the baby exactly what they need. How could that then miscalculate and give the baby cavities?
It's ridiculous. It's ridiculous. And I mean, the only thing I tell people is they can wipe baby teeth with a liquid xylitol, just a little solution, get some crystals, put warm water, and clean, because the teeth that are most at risk for early childhood caries, it's high up on the front gum line of these new erupting incisors. And you can just wipe away any plaque. I mean, again, ideally you get the mom's mouth plaque free before the baby. That's the ideal. But if you have a mom who has bad teeth and a history of them, wiping these teeth with a little solution of xylitol is added protection, because it's really anaerobic bacteria that sometimes there's a ledge. I don't know how many kids you've seen, but often kids in these primary incisors, there's almost like a little ledge right up by the gingival margin. I think it's the 3-month stage in utero that they're growing, and often people are not well. Moms feel sick, and
sometimes they call that a fever line.
Yeah,
right?
Yeah.
It develops when the mom has a fever, the kid has a fever, and they get that ledging.
And that little ledge attracts plaque, but you can keep it clean with a solution of xylitol. Just wipe it over, basically. I mean, it's so easy on a little cloth, or they make a baby tooth wipe if you want to.
They make everything.
There's a quarter.
So then I have a good follow-up question for you, because I have a lot of young mothers in my practice. Their concern would say, I have bad teeth, my kids have bad teeth, it must be genetic.
I love that
but
one.
you're saying it's more
it's direct
transmissible.
transfer.
So I think that's a great point. If we can speak to,
sure,
you can educate us on this.
Well, this is where it's so frustrating. The study was done in 1970s, where they took these mothers with really bad teeth. They had 100% plaque measurements when they took salivary samples, and they gave them chewing gum with xylitol. They gave them a blister pack with enough for them to actually have 6 grams a day. And they just had to eat their way through this blister pack of chewing gum and put it in, chew. It doesn't have to be chewing gum. It can be mints too. They work the same way, but just get little bits, tiny amount of xylitol at the end of meals and throughout the day. And they were able to measure the strep mutans levels actually going down progressively, month by month by month. And it was the guys from Finland who did this anyway. They knew the results before they started, but they started in the 3rd trimester of pregnancy. So for 3 months at the end of pregnancy, these women had 6 grams of xylitol every day. And then after the baby was born, they had another 3 months to 6 months before the baby teeth erupted. What they discovered in their testing was at the end of 6 months, you had 98% of plaque strep mutans bacteria gone. Now, we didn't know then what you are passing to a baby, but I think anyone in the xylitol world then sort of assumed there must be good bacteria. The Human Microbiome Project was actually 2007 to 2014. But in the xylitol world, we knew that something bizarre happened with the xylitol, that it was promoting bacteria that then, when the researchers went back, they took all the xylitol away. When the baby was a year old, nobody had any more xylitol. In the baby, the mother, baby never had any. And what they found with those children at 6 years old had 85% less caries, less cavities at 6 years old. And that it went on being a benefit for life. Well, what we now know is it's the infection of teeth from the mother or the caretakers. And once you got one baby tooth infected, when the one comes up next to it, guess where it gets its bacteria from?
Right next to it.
The one next to it. It's once you've got it started, it's ongoing unless you've got a horrible diet happening. But the really important thing is when you've got baby molars, you've got these deciduous molars, they have grooves in them. And whichever bacteria get in fissures dominate the mouth, whether that's a first permanent molar or a baby molar. So if you, in the 2nd year of life, when those baby molars are coming in, you can ensure that they're healthy. I would recommend xylitol. I mean, that's how I've done it with my kids. Then the permanent molars, when they come in, become colonized. We call colonized instead of infected, but it's the same thing. And then they transfer that into the adult mouth. So a sealant that really isn't, I don't know when you would use a sealant. I would rather try to keep this visual, because you can inspect a tooth that hasn't got a sealant and see is there caries there. And if you could put that child on a program that I would recommend with some dilute sodium fluoride and xylitol, you could then inspect that 6 months later and probably find that caries has gone away.
So maybe that's where people confuse genetics and then earlier bacteria infiltration, because they assume it must be genetics. But you're saying, no, the bacteria got in there at age 2, and that's driving your oral health.
Totally. And siblings, there's what they call vertical transmission, horizontal transmission at daycare, kid to kid. That's what we were saying earlier. In today's society, you can't say it's just food, I don't think. Weston Price was in little isolated communities up the Alps and on islands and in the rainforests. I mean, today we live in big cities and groups with people who don't have perfect teeth. I worry for the periodontal health of workers in assisted living. Do you know how bad most seniors' mouths are in assisted living circumstances? How much of that do you think is transfer?
Mm-hmm. This may be the perfect transition, because a lot of my education to patients is diet. I know that's Dr. Ameet as well. And we spoke at dinner yesterday about fluoride. And all my patients and friends and family want me to push back on you on fluoride and hear your explanation why fluoride in the water is not good for you, but topical fluoride is a benefit.
Absolutely. I mean, this is what again, you have to know my story. I grew up believing that you should drink fluoride. We're talking about the 50s and 60s. They put it into the Michigan water supply here in America in 1945. So 15 years in science isn't very long. So in England, there was no fluoride in the water, but they'd heard the wonderful things going on in America. So we had little tiny bottles of sodium fluoride that we could give patients. And you could also give it to moms to give to their children. So when my first baby was born in 1977, I kept putting fluoride in her, as soon as she had food or drinks beyond breast milk, I would put fluoride in her food, and this was like a vitamin, is what I'd been told. And then my next daughter, because my kids were born very close together, was born in 1979, and then my son in 1980, they all had fluoride. Now, at that point, I came to America, and the child born in 1977, you know that the front teeth come through 7 years old. So I'm at the University of Rochester when her front incisors come into the mouth. They're brown. They are mottled and brown, chocolate brown. I'm like, what is going on? I had been trained to believe they were going to be shiny and white and healthy, and now they're chocolate brown and all gnarly. My second daughter had white mottly spots. This is fluorosis. My son had molars that were messed up, hypomineralized. And I think it was all from giving them that fluoride at that time before the age of 7. And what happens, because I had to do a sort of thesis thing for I was studying pediatric dentistry at the time. So I made this my mission. This is before the internet. We're talking about 84 now, 83, 84. I had to go to the library and I pulled out all the books about fluoride. And yeah, there's a whole story of it. There's a story how the Aluminum Company of America, very conveniently started selling their byproducts to the American government. And there's a lot of hanky-panky going on there between everybody. And it made me really mad because I'm a mom who's just poisoned basically 3 of my kids with the stuff. I would easily be an anti-fluoridationist, wouldn't I? But I had just had 10 years of using topical application of fluoride in the form of a mouthwash and a toothpaste with adult patients Because as I said, in England, I was doing adult family dentistry, but mainly adult dentistry and special needs dentistry. And then I came to America, I had to choose a specialty. So I became a pediatric dentist. So this fluorosis that developed in my kids only develops before the age of 6 or 7. You have to ingest it while the teeth are forming because it kills, it damages the ameloblasts, which are the cells that actually secrete the enamel as the baby teeth, as the adult teeth are forming in the baby's jaw. Baby teeth are fine. Then they're formed in utero, as we were talking about. But these adult teeth are formed from birth until the age of 6, 7, when they start to erupt and you start to see them. So don't ever want to give children fluoride prior to the age of 6. But I had seen fluoride as a toothpaste, as a mouth rinse work for adults. So I'm in this catch-22. And I actually worked with the city of Austin to get it taken out of the water supplies. And it should be taken out of the water supplies. And I want to say that really loud and clear because who is most damaged? The children under the age of 6. I mean, if an adult wants to brush their teeth with a fluoride toothpaste, the one I recommend is $1.95, and it'll last you almost a year. Great big tube for $1.95. If you want your kids to use fluoride, it's not expensive. It really isn't. It's about $4 a month. So that's how I got into topical application being very different from ingestion. I don't want to ingest. And people don't understand that iced tea is full of fluoride. You've got some green tea there. Brewed tea has a lot of fluoride in it. And that's not toxic. Our skeleton requires a little bit of fluoride in order for it to be strong and healthy. So to be so scared of fluoride, I have these people who won't even listen to me because I am a believer in fluoride. That is absurd. Fluoride's in raisins. I mean, fluoride's in wine. Fluoride's in potatoes. I mean, maybe you need to go and look, and if you're so scared, see all the foods that you might be consuming that has, especially tea. Tea is high in fluoride because in the countries where it grows, fluoride's in the soil. I mean, we have fluoride in the world, and then there are different kinds of compounds. I never recommend stannous fluoride because it actually damages the cells, the bacteria in your mouth. But not sodium fluoride. So it's really tricky. You have to be educated about it.
So it's more nuanced than, you made a joke about this yesterday, it's more nuanced than fluoride calcifies your pineal gland, it's a neurotoxin, and then you lose all your empathy and you can't meditate.
Yes. I mean, I've used my system with fluoride, topical fluoride, for over 40 years. I think I'm still pretty empathetic.
I would agree.
And
only
Dr.
my
Ameet
friends
said he would agree as well.
It's funny because the number one thing I get is fluoride is a neurotoxin and it kills your brain cells. I'm like, the amount of things in our environment that's doing that is mind-boggling.
Well,
and you're running on this one. This is your platform. I mean,
that's true. I mean, I think what they saw were when the levels are really high in that young age group, when lots of things are forming. You have to be careful what you feed children. So I have 2 more children after those 3 that I poisoned. And I will tell you that my oldest
temporarily poisoned, though. They're still with us.
Well, their thyroids are not good, the girls.
Yeah.
They had trouble conceiving. I am really worried about little children drinking fluoride excessively. And I have to admit, I gave them what I would call an excessive dose. It was the dose I was recommended. Mm-hmm. But you should not see this as a supplement. It is not. What fluoride actually does is it speeds up remineralization. So if you know how to make your body remineralize your teeth with this mouth resting, good diet, ending, not sipping, doing these practices before bed at night and in the morning simply speeds up. I mean, what I learned is that fluoride, it doesn't change your teeth. It just puts sort of a catalyst charge on the outside of your teeth so that the minerals go in faster. And we see that in the maturation of new kids' molars. When kids have molars coming in at the age of 5 or 6, they're like sponges. They're not fully mineralized. They come in, that's why they decay so fast. It takes a year for mineralization to occur, the absorption of minerals from the mouth, and that's if they're not sipping water all day. So it might even take longer, which is why most kids in America, I think the data shows most first permanent molars are sealed or filled in America. But if you use a dilute sodium fluoride mouth rinse, just as those teeth are coming in, like the kids act, and I have nothing with these companies. I mean, I still have to buy my toothpaste from wherever. But if you do that, they have shown that those teeth will mineralize in 3 months. So you reduce the time from a year to 3 months. So what is that? That's like quadrupling the speed at which it mineralizes.
So a good question I would push back on is, can you have a healthy mouth and teeth without fluoride?
See, I don't know. My youngest daughter had healthy teeth. She'd had xylitol up until she was 6, 7. But then I put her on my complete mouth care system. So I can't tell you with her, but I can tell you in countries like Denmark and Finland, all they do is xylitol. And there's mouth resting, and I mean, they have sensible mothers take xylitol. For mothers, it reduces preterm birth by 25%. 2 pieces of xylitol gum in Malawi were able to show that preterm birth in pregnant women went down by 25%. And now these OBGYN doctors want to show that that was because it reduced the amount of periodontal disease they had. They cannot get the funding they need to do this. They cannot get, $200,000 to do this. Why? Because there's no interest in it. 2 pieces of xylitol chewing gum did that. That's so sad. But I think we can all tell our patients, if you're pregnant, at least have 2 pieces of xylitol, either gum or mints a day. Mm-hmm. So did I answer your question?
You did.
Are you convinced?
One of my best friends is like, please push Dr. Ellie on fluoride. I'm not fully convinced. Fluoride still makes me nervous. But I'll tell you, like,
do you drink tea?
I don't drink tea. And I have to ask you a question how you function without coffee. But no, I don't drink tea. I drink coffee because I have 4 kids.
Do you eat raisins?
I do not. Because they're more of a dried sugar, dried fruit.
Okay. Potatoes?
I do.
Got fluoride in them.
Yeah.
Does that terrify you?
Now I'm scared, but I wasn't before.
I mean, you have to understand there's naturally occurring fluoride, calcium fluoride, naturally occurring in the soil, in our food. If you did not have fluoride, we'd be jellyfish. Mm-hmm. You require fluoride for your bones to ossify. Without it, you would be a jellyfish. So being scared of nature is more terrifying to me, to the true nature and how it was designed. Like being afraid of that, I think that's a problem in its own self. But people don't realize, like, you take up skulls from 3, 4, 5, 600 years ago, 1,000 years ago, super mineralized teeth, and there was no, exogenous. The fluoride was coming from the soil and from the food, and they were doing just fine. So to answer your question, yes, 100%. Can you have beautiful, natural, highly mineralized teeth without utilizing products that you're talking about? Absolutely. But the problem is the diets that people have today are nothing like they were 300 years ago.
Agreed.
And it goes back to the diet again and mouth resting. So you can do the fluoride, and I think it's a great thing to add because modern times, you need a modern solution. Well,
and if I could add that, which is worse, to have a plastic filling in your mouth or a sealant in your mouth, require that, so you've got plastic at room temperature in your kids' mouths, or do you use this product that you then spit out?
No, I agree with that. And I do have patients that have a very high caries rate, children, that I do recommend topical fluoride.
Yeah, so, but you mean you're painting it on?
Yes. Or they use your mouth rinse system.
Yeah, I would highly look into the benefits of the daily, twice daily, compared with painting on a stronger, stickier, I mean, I think the varnish and fluoride, but the gels, I think, are quite toxic to some of the mouth bacteria.
If anyone, I don't know, remember I was a kid, you had that gel, they
It's
put it in
11
the foam. And
Yeah.
I'm traumatized from that. To this day, I think it's just so painful.
It was 11,000 times too strong.
I don't even know
this is the problem.
Yeah.
If a little is good, more is better. No, that's not true. And again, I think people need to understand that how did they discover fluoride in the first place was because it came down from Pikes Peak with the snow melt.
Oh, right. Yeah.
I mean, this dentist in Colorado Springs is like, why do all these teeth not have tooth decay?
Mm-hmm.
And they had the brown mottling because they had too much fluoride. So it's up there in the mountains. I mean, it really isn't as scary. It doesn't have the connection between Aluminum Company of America and toxic waste and putting it in our water supplies. That was a very unfortunate thing that happened, in my opinion. But learning about the ways that we can make our teeth stronger with the use of fluoride came out of that.
Mm-hmm.
But I would never, and nobody should be be consuming fluoride under the age of 6.
Systemically.
And therefore, that's why most kids eat toothpaste.
Yes.
So I don't recommend a fluoride toothpaste until they're at least able to spit it out and not consume it. And then you use a tiny amount.
That's kind of shocking now that I think about it. Like, because the anti-fluoride people, I understand it's no fluoride forever, but I like what you're saying here because that's like it's a prescription-based treatment. Mm-hmm. She's thinking about when will this be most beneficial and, in prescribing out. And that's what we should be doing as doctors. We should prescribe things and not just blanket everybody with this fluoride bomb at all times. And I think that's a really smart way.
It's very hard to
it.
Talk to people because, if they say,
yeah.
Are you talking about, and the trouble is the Crest toothpaste I recommend is the one that's usually on the lower left-hand bottom shelf of somewhere because it's the $1.96. The Pro Health or whatever it is has stannous fluoride. I don't want you to have that one. That isn't the kind of fluoride I would have you have. Sodium fluoride is a lot like sodium chloride. The chemistry element table. What is sodium chloride? Table salt. We've just got the sodium fluoride, the table salt of fluoride. I mean, in some countries, I think in Mexico, they put fluoride in the milk. So if you want to drink a fluoridated milk, you can drink it, if that's what you want to do. And in Switzerland, they used to put it in salt. Kind of like they used to put iodine in salt, so you can decide you're going to add that in your food if you want to. I mean, I wouldn't do that. I think I eat seafood for iodine and things. I mean, yeah, if you can find out, and if a couple of cups of tea a day is fine, just because it's got some fluoride in it, you don't have to give up tea. We know it's got so many benefits for you. I'm not, it's balance. It's not all bad or all good, just like acidity, right? I mean, eating a meal is going to make your mouth acidic. As long as your mouth rests, that's going to be repaired and regenerated. You go to the gym and you lift weights. What happens to your muscles? You break them down. Does that scare you? No, because you rebuild and regenerate. Because you eat well afterwards, right? Mm-hmm. And you rest.
We may be touching on a deeper problem of more nuanced. And we discussed this yesterday. A little bit of knowledge is dangerous. So if you know just one headline or one TikTok video, you may be scared into something that if you learned more about it, it's more, like you said, more individualized treatment for the person.
Yeah. I have a 1-hour YouTube video on fluoride. I mean, I knew nobody would watch it, but I wanted to put this story out there of my own experience, because what would a mother who's done that to her kid's teeth, you would think I'd be the first one to be scared of fluoride. Mm-hmm. And I was, but then I had to figure it out. And you're right. I appreciate that you see that it's, and as far as my daughter, the youngest one, who's never had anything wrong, but she's pregnant now. And the acidity that your mouth turns to become when you're pregnant, I'm glad she's using fluoride. And I don't see it as any negative consequence. If she wants to make her baby smarter, play some Mozart, play some classical music. I think,
Get them, make sure they're not on the iPad and on, there's a lot of things you can do.
Yeah, you were telling me that blue lights.
I just read a study recently that all this blue light in this room, although it's well lit and we all look beautiful in it, can change the composition of your saliva. We have something called circadian biology. circadian rhythm. And if our internal clocks are thrown off by all this artificial light, health just unravels.
Mhm.
And it does cause damage to your mouth as well.
Huh. Isn't that interesting?
Surprise, surprise. You leave the ecology and you go into modern times and everything starts to unravel. That's the foundation of most of the ill health we have. It's the fact that we left, our hunter-gatherer times, moved into civilization. We sat in one place, we started living in one area, and literally that was the nexus for most every disease process, was us breaking away from the natural world. And so I think, fluoride is from the natural world. It should be brought in just as well. Good diet from the natural world. It should be brought in. And then, I might go on a slight tangent here, but I think as long as practitioners look at the fact that we came from nature and we should utilize nature to actually enhance our structure, using subtle instances like when you look at a child's teeth and they have tooth decay in their front six, the first thing in my mind, mouth breathing right off the bat. I know they're mouth breathing. So when, you see caries, you subtly think about first of all, I like caries, I like saying it, or cavities. It minimizes the problem to the entire society. It's a dental infection, or just it's an infection in your mouth. And when you make it more like that, then it makes them think, wait a minute, I have an infection. Whenever you say the word infection, people go like, oh my God, I have an infection.
Yes, I was shocked when I came, because this 1970s study showed that it's a transferable infection.
It's a communicable, it's the most common communicable disease on the planet, and nobody knows that.
Well, why don't they know it?
Because they mitigated it. I don't know who the they is, but it's always, anything about the mouth has been subjugated by the heart or the lungs or every other body part. So I don't know if it's like when medical and dental split off, because dental was part of medical and then it split off and they're like, the mouth is way over there and has nothing to do with this.
Yeah.
And that is just crazy, because the body is not it is one entity and to be treated as such. So the mouth, the heart, the lungs are all the same. And so, I can go crazy on this, but once we start doing this in our minds and we start pushing things away, then they no longer have any importance. And so I think as our own industry has to start bringing it back, you have an infection, whether it's in your teeth or in your gums, an infection is an infection. So it's important for people to understand that your mouth is the beginning of your digestive system.
Well, yeah, but then that soundbite gets taken and people start taking oral probiotics, expensive oral probiotics.
Yeah.
That's not the microbiome of your mouth is actually much more like the microbiome of your skin. You have to modulate it. You can't just throw probiotics.
It's a very complex system.
Very
and the
complex.
biome of the mouth is the most complex biome of the body. And
Absolutely.
So we've just underestimated how complex the mouth region is, mouth, oral,
nasal connection.
And then you're now into the head. And that's how I got into airways. Like I started with the mouth, I got the teeth, the gums, and then I'm like, well, why is everything the way it is? And I got into, well, kids, when they have tooth decay in the front, it's from mouth breathing. Well, what causes that? A restricted airway. Why is it restricted? Because their maxilla and their mandible is too small. Why is it too small? They weren't breastfeeding. And so it goes all the way back to the same thing. We have left our natural world and traded it for modern world. And in that trade, you traded health.
Yeah. Yeah.
I could not say that better.
Yeah.
What are we trading? What is the price we're paying? Because in modernity, there are great things. I can fly down here in a few hours. Beautiful studio. But there's also cost to living in this environment.
So what realistically for people, I mean, somebody having a baby now, breastfeed for as long as you can, go to a dentist.
I mean, a dentist who's trained in understanding that now you have this child in utero, and the moment that kid comes out, there is a process to understand. And for their dental health, their oral health, their airway health, you can make those decisions in utero. Like you said, like the mom has a certain health and you do that. And as they come out, we will set for tongue ties. Do they have any tongue dysfunction, lip dysfunction that will then make latching harder? Because if they're not latching, they're not getting the breast milk. If not, then we started the domino effect. But it's in that first few days, let's take a look at that tongue. Do they in fact have a tongue tie?
You think too many tongue tie surgeries are done though?
Well, they're not. They're done, and they're done incorrectly. And then once they do it incorrectly,
scares me. Talk about fluoride scaring you. Tongue tie surgery with lasers, because you've got those sublingual glands there.
It's actually pretty easy. If you're trained in it, it's it's super fast. Maybe like 30 seconds. Boom, boom, boom. Lasers are rapid.
And you don't think there's any risk to searing up the sublinguals?
There's certain lasers. And if you use like a cold laser, like a CO2 laser, it's not ablative. It's not heat promoting. But the number one way they do tongue tie releases is actually with a scalpel or a scissor. So if you're using a laser, you're already advanced already. So you're not cauterizing anything. So the practitioner has to be very trained in this. But the problem is most practitioners are heavily undertrained and they're using scissors or a scalpel. And it's
So why do you think that there are so many tongue ties? Let's talk about that.
They found this to be genetic, and it goes back to even the Roman times, ancient times, tongue ties existed. And
you don't think we're just making this up?
No, it's been there. In the history, they had women who were like doulas or midwives, and during the birthing process, and in their culture, these women would have really, really sharp fingernails, and these really sharp fingernails were a tool because when the child was born, as soon as they're born, they assess for the ties, zip, zip with their fingers.
Oh, wow.
So these women had these sharp, because they knew that if you have this dysfunction, then the latching is going to be a problem and the domino effect will continue. And they were breastfeeding for 3 to 5 years, 6 years. The teeth were fully developed at that point, but they did it because now their facial form was fully forward. They had no airway issues. They didn't have malocclusion because they followed what the design was. And they knew when there was an offset of the design in the tongue ties, lip ties, they took care of it. And then they did the exercises with the tongue and the lips to make sure they don't reattach. That's where we fail. They clip them and they don't do anything. They reattach, sometimes worse than what they were before they did it.
Wow, I didn't know that.
So
a question our audience might be asking you is, because we've been talking about, we left our natural environment, we're designed a certain way. A question might be, well, if we're designed for health, why do we get these tongue ties?
That's what I was saying.
It's a genetic abnormality. It came into the situation, we don't know when, but it just started up. It's an evolution. Maybe we're still in the evolutionary process. Our bodies are amazing. I can go into it forever, but even our little pinky finger, I cut it and then it'll figure out how to stop bleeding. We can't explain it. We can't create a machine to do something that amazing. The body is dynamic. It's evolving. And I think the tongue tie is just part of that, and eventually will roll itself out.
I don't know. I've always thought that it was because they were making too much money from doing tongue ties that there was this uproar in tongue ties. But
that's a hot topic with all my patients.
Yeah.
So let me ask you, as a practitioner, how do I know if a patient needs a tongue tie release?
You have to understand how to assess for a tongue tie. There's education on it. You can. I can teach it how do you do it, but there is an education, and I think all practitioners, every dentist should know this. Every pediatric dentist has to know this information. Every physician, every OB-GYN, but nobody knows it. They're just like, oh, it looks okay. No, there's an assessment that goes with it. There's a whole protocol for that assessment, and you should see it as a newborn. That's when it should be first assessed. Yes, the child is this, do we need to release it? It's based on whether or not they're symptomatic. Are they having latching issues? Is there a problem with feeding? If that's the case, it's a functional one, we need to do something. If not, we'll let them grow. And then all of a sudden they have speech issues. Their tongue they can't even move. And you're doing these speech courses, speech assessment, speech therapy. The kid can't even move his tongue. And so assessing it throughout all the healthcare providers, it's really important because their jaws will not develop appropriately if that tongue is tied. And why? The tongue is your orthodontist. You don't allow it to do what it's designed to do, you will get malocclusion. You don't allow it to do what it's designed to do, you will have a restricted airway. And now you've sent this kid into an entire world of ADD, ADHD, irritability, behavioral
Should you
issues.
Close a baby's mouth when they're sleeping? Should you?
Yeah, you should you can do that. You can, but the problem is if the child cannot nasal breathe, their body's opening the mouth as an emergency hatch.
Sure.
You close that hatch,
Yeah.
you've now made the problem worse. So first we have to figure out why they're not nasal breathing. Is the room too hot? Are they always congested? Why are they always congested? Is there an environmental allergy that they're now responding to? Is there a dietary allergy they're responding to create this inflammation? So you can't just do one thing without asking the question, but why are they opening their mouth to begin with? See, all parents, when I tell them, always ask the question, why? Why is this happening? First, you have to understand what's normal. Nasal breathing for humans is we're obligate nasal breathers. Breathe through your nose. If you're not, ask the question why.
That's a perfect point. I think with all health modalities, ask why, and is this a symptom of something else? Because as a parent myself and as a dentist, I'm pretty ignorant to tongue ties. So you have to look towards professionals, but you also have to be your own investigator.
Yeah, because again, if you're going to go to an insurance-driven practice, you might be getting tongue-tie surgeries that you don't want that aren't necessarily helpful. It's back to the same thing. You've got to trust that the person you're working with knows what they're doing, right?
And you have to have enough sense of your own to evaluate them. Because your dentist and your doctor is not your high priest. They are someone that just, with some expertise, helps guide you on your journey. If you just look to your dentist or doctor and take everything they say word for word as the gospel, you're making a huge mistake for your own health.
Well, I have a very interesting time because I have this thing, a boot camp on my website, and people will share their stories, how they go to the dentist. There are a lot of people who go to biologic dentists. They're so anti-fluoride that they're scared to tell them what they're scared to say that they're using fluoride toothpaste and mouth rinse. I mean, that's ridiculous. Isn't that ridiculous? I mean, they're intimidated even when their mouth health has dramatically improved. I mean, it's a catch-22.
Sometimes I wonder, I'm not a biological dentist and I'm not speaking poorly of them, but if some practitioners are so identity-driven that their patients are fear of judgment. I just saw this girl on TikTok that got a crown and now it needs a root canal, and she hasn't been to the dentist in 10 years because she was afraid of judgment. Mm-hmm. So I think too, if you you're non-judgmental, if you find a practitioner that's not judging you, they meet you where you are. Yeah. And all humans judge, but we're actually here to help you. We're here to heal you.
Yeah. Yeah, absolutely. So we do have to talk about night guards.
Why not? I'm in a fighting mood.
I have only benefited from our relationship, and I'm an avid follower of you on your social media, and now Dr. Ameet. And Dr. Ameet has this saying, and I said it 3 times, and it makes me feel powerful, that a night guard is a $700 Band-Aid. And then you say that, and people go up in arms with pitchforks. So now I want to hand this over to you so I can avoid the fire.
Well, I would like just to interject, if you don't mind, that I have never made a night guard in my entire life because it's a Band-Aid. I will never recommend Sensodyne toothpaste for the same reason. It's a Band-Aid. But go ahead, take it from here about night guards.
I mean, yes, it is a Band-Aid, and a lot of our treatments are Band-Aids. When you sit back and look at it, I mean, we go to school, we do the thing, we toe the line, we fight the battle, we sing the battle cry. And then if you just step back and look at everything that we're doing, a lot of them are just Band-Aids. And a night guard is, once I got into Airway Dentistry, it was just a hilarious Band-Aid because I made my own night guard because I have TMJ issues, clenching issues, but I never asked why. And I've made thousands of night guards in my career. I mean, just so many, and I took special courses and understood the TMJ and all these things. And basically night guards are the ultimate, and they have night guards that are like $5,000, like just crazy levels of just night guards. And the funny thing is I never stopped clenching. I never stopped. I had night guard after night guard clenching.
You got more
yeah,
stuff
and then I'm
in
like
your
chewing on this thing, and I'm like, what is going on? And that's when I found out why I was clenching. It's not because of stress. It's not because I'm stressed. I'm pretty chill, dude.
You're pretty chill, dude.
And I'm like, what is this stress? What am I stressed out about? You know, being a dentist, I don't know. What was it? And then I found out through what, just in my journey, I found out I was diagnosed with moderate sleep apnea. And I do not look like the poster child for sleep apnea, and when I found out, I was just so mind blown. Then you add up all the symptoms and you're like, oh my God, that was my whole life. And it was, sleep apnea is an airway obstruction, but it started as a restriction. And when you look at the science of airway and airway restrictions, clenching is a protective reflex your body does when you have a restricted airway.
Yeah.
And I was like, well, that makes sense. Well, why would you clench your teeth if you have a restricted airway? Well, when you go to bed at night, you're in the horizontal, you're unconscious, your jaw slacks back, and then it starts squeezing your air. Your body's like, whoa, I'm getting less oxygen. I don't like this. So things happen and it'll tell you to clench your jaw. Why? Because now your jaw tightens up, goes forward and closes. That moves, it opens your airway because now your jaw is no longer
Do you know what
slack.
also happens? When you clench your teeth together and you compress the periodontal ligaments around the tooth, all of the periodontal ligaments, they're sort of, I tell people they're like the bungee cords around a trampoline. When they're compressed, they send a message to your brain, and your brain releases a hormone called orexin. And orexin is a wake-up hormone. It's actually, when you wake up quickly, it gives you a spatial feeling of where you are in space, so you have balance. Eyesight, it's connected with eyesight, it's connected with cognitive thinking.
It would make sense because your body is trying to tell you, hey, you need to
wake up and
you
do
need to
something.
wake up and do something, or shift you should turn or
Exactly.
something. But it's a protective reflex designed by your fight or flight system because you're under duress, stress. So once I learned all this stuff, I'm like, wait a minute. So every patient I've given a night guard to, that was them all having an airway restriction. So now I can actually talk about what causes. So I rarely give night guards. So I was so pro night guards, and after being educated and understanding why they need these night guards, I rarely do not. It's so rare. And so it's amazing because now I'm treating the actual problem. So I treat the restriction and they stop clenching. No night guard. Now it's just in the garbage can.
It's wonderful.
Is it fair to say that you could still grind or clench your teeth if it's not an airway issue?
Correct. It's not always 100%, but it's the vast majority of bruxism, airway restriction.
Okay.
Now, could it be like some sort of magnesium deficiency? There are some antidepressants that also elicit that same response. There's individuals who have PTSD that response has been triggered from a young age. It turned on their fight or flight system. And so now there's hyper signaling, and maybe the wires got crossed a little bit, but there are other avenues to look at for sure. But to negate the vast majority, first look at this. And if that's not it, let's start looking at the other nuanced reasons.
So there could be an emotional component as well.
Absolutely.
And to add to your point, the physical duress of a restricted airway could add to an emotional component. Then there's a vicious cycle of physical, emotional, airway, clenching, grinding.
Of course.
And a whole slew of issues.
And then you put a night guard in and it makes it even worse.
Yeah,
And
because it's an airway restriction. Your oral space is part of the airway. So if you put a night guard in there, you further restricted it. A lot of these people are like, I cannot tolerate it. I go with the sleep and it's across the room. And it's actually a hallmark signal when a patient says, I have a night guard, but every time I wake up, it's literally across the room. That's their body saying, absolutely not. They generally have sleep apnea.
Yeah. And I mean, this thing, people fit in a night guard because they're grinding their teeth. I would then say to them, well, what are you preparing your teeth with before you go to bed at night?
Yeah.
Because if you're using, the number one selling natural mouth rinse without fluoride is acidic, has a pH of 3.5. So if you rinse with that before you go to bed at night and you are grinding your teeth,
Yes.
they're going to grind away because you soften them. Even if you were to clean your teeth with my complete mouth care system, but then decide you're going to have a sparkling water or glass of wine before you go to bed at night, you're going to wear your enamel away. So people get fitted night guards for this enamel wear that a dentist sees. Again, I would investigate why they have this wear, but also what kind of preparation before you go to sleep at night are you doing?
So it sounds like if you have worn down teeth and you're grinding, there's multiple perspectives you have to look at
Oh, yeah.
to restore them.
First, start why you're clenching in the first place. Start with that. Then that's generally how I start, moving into it. So I'm going to dole out a prescription for a filling or whatever I'm going to do. I could equivocally say, like, if I can get this clenching under control, anything I do should not break because you're not putting crazy stresses on that. And then we talk about the actual density of your enamel through Dr. Ellie's system or something similar. And then you just create this beautiful environment that was the original environment, and you get patients back to it. And surprise, surprise, everything lasts, nothing breaks.
And then everyone loves dentists again.
Yes.
Yeah.
And that's the whole mission of this podcast, for you guys to like us again.
Yeah.
That's been my goal the whole time.
So what do you think about xylitol? What's your experience with xylitol?
I am pro xylitol. Personally, if I eat too much of it, and my patients would complain of this too, it gives them
GI disturbance,
gastrointestinal issues, or sling, gives them diarrhea. And I wouldn't know where to tell patients how much to give and how much not to give. So I would actually move it to you or Dr. Ameet.
Well, I mean, it's on her bottle, actually. I use her stuff. So.
The thing is, you want to have it at the end of a meal. Xylitol is made by our bodies. We make 15 grams a day. So 15 grams a day is obviously what the body is used to. But we're talking about adding 1 gram, perhaps, at the end of meals 3 or 4 times a day. That's all you need. You don't need great amounts. And I think the people who use granular xylitol sometimes eat more of it. But and I don't know what kind of xylitol you've been consuming, but
I recently bought your product.
Mine, and that still does that to you.
That's been great because I have a lot lower amounts.
Okay, well, there you go. I mean, that's what a lot of people do is they get granular and they're eating too much. They're having like a teaspoon at the end of a meal.
Yeah.
Most people don't understand. You shouldn't be like, it should just dissolve in your mouth. That's why I like your tabs, because they just pop it in there and let it dissolve and let it kind of coat everything. You're not should be
totally.
It's like fluoride in the water. Like you need it in the space. You need to sit in there. So that's why the tabs are better than people mix as a sugar substitute. That's going to give you diarrhea. That's not where you need to be.
Well, it gives some. It's fiber. The problem with xylitol is it's an insoluble fiber. The good news about xylitol is it feeds the very bacteria that create a healthy gut lining. So they create butyrate. If you know anything about butyrate, butter has butyrate. Mm-hmm. And butyrate is basically foundational gut lining down in your colon. And it prevents this leaky gut syndrome that people get. So xylitol, although a lot of people with leaky gut have a problem because they can't eat fiber, if you can get your gut healthy, then you'll gradually introduce xylitol and you'll be just fine. I mean, I tell 2 stories. One is how quickly the gut adapts. I guess the Eskimos used to eat blubber, the whale blubber all winter, and then they turned to being grain and vegetables and things in the summer. And they would go through a period of a week of adjustment, which must have been pretty interesting because they were going from all fat to a fiber diet. And you'll have discomfort doing that unless you prepare yourself. Now, because I'm in the xylitol world and I've heard this from some people throughout, I've never experienced this myself, but using a probiotic for your gut health, a foundational probiotic that's going to help make that mucusy, butyrate-y thing. And I recommend BioGaia. It's a Swedish company, and I recommend the probiotic for immune health. And if you start with that, take 2 of those little pills first thing in the morning with something cold. Don't drink your coffee or anything hot for half an hour. Let that go down first. And then start maybe with 1 mint after each meal, and then gradually you'll find you're absolutely fine with more. It's just if you throw yourself into, people used to come to the demo tables. They'd never tasted xylitol, and let's try the cinnamon. Let's try the cherry berry. And I was like, no, this is not how you eat xylitol. You want one mint. My son ate a whole jar on a trip across America. I mean,
they're kind of good. I'm not going to lie.
Well, that's not, they're gold dust, and you use them for their benefits of feeding your good bacteria at the end of a meal. Use it appropriately. You really shouldn't have a problem with a good, well-made xylitol.
Use it as prescribed.
But if you're going to buy the Trident gum, the main ingredient in Trident is sorbitol. Sorbitol will upset your stomach. Completely different system.
A good question to ask you is, you just promoted probiotics for your gut, but then you just admonished probiotics for your mouth.
Yes.
Where's the difference in biology on that?
Because the biology of your gut is very, very different from the biology of our mouth. Our mouth bacteria, 80% of them are woven into biofilm. And I actually went to a biofilm conference, sat next to a skin specialist from one of the skin companies, and they wanted me to go to dinner with him, but I gave him my book and said, I got to go to bed. And he read my book, which was Mouth Care Comes Clean, the book I wrote about 10 years ago. And he got in touch with me saying it was extraordinary how similar biofilm on the skin is to biofilm in the mouth. And I mean, your skin, you don't see bacteria, you don't, but if you got bleach and rubbed it on your skin, you'd have a red raw patch, right? Because you dissolve the biofilm. Our skin is designed for what it does, and our mouth is designed for what it does. And it doesn't accept, it actually defends us from, unwanted bacteria. If you've got a healthy biofilm, it's there as a defense. Defense against temperature. You shouldn't have sensitivity to hot and cold. Defense against mechanical damage and abrasion and abfraction and all that stuff if you've got healthy biofilm. And also against infection. So developing healthy biofilm, which is 80% of your mouth bacteria, is critical.
So it seems like we're circling around two major concepts here. Balance the bugs, protect the airway, which may be the root cause of most of our oral issues.
Yeah, I'd say.
I mean, you breathe through your mouth, you're going to disrupt that biofilm. You disrupt the biofilm. Hello, cavities.
Well, because the worst thing is for biofilm is dryness. Obviously, that's how you get rid of. I tell people to dry their toothbrushes for 24 hours. Stick it in a little donut thing and let it dry for 24 hours. It'll be completely clean. I know you boil yours and do different
once
things.
Once a week, I do my things.
But just drying it, for most people, that's a simple thing to do. They just need 2 toothbrushes, one for the morning, one for the night. It will be clean. I mean, they've done studies to show that bacteria die when they dry. If you have a dog, you're trying to clean the dog bowl, right? You have to dry it. Otherwise, it's always got biofilm on it. So dryness, that kills bacteria really fast. And the second thing I think is these really strong acids that people don't realize are in the drinks they drink today. Most drinks are pretty damaging to
sparkling
biofilm.
Water. I've been beating the sparkling water drum for the longest time, and people don't like to drink water. I don't know what happened. Water just fell out of favor. Water has to be something. Something's got to be in it. So let's put bubbles in it. What are those bubbles? CO2. When you take CO2 and mix it with H2O, you get carbonic acid.
Yes.
It's chemistry 101. Carbonic acid pH is 5.0 or less. Demineralization happens around that area. So your
biofilm gets destroyed.
and your biofilm gets destroyed. You're literally what are we doing?
Well, and your ally is xylitol, which nobody's ever heard about. And in your nose, when you're giving patients who've got nasal problems, I use xylitol nasal spray preventively. And especially if I'm in Colorado or somewhere with dry climate. It's fabulous. It's really a huge help. And even if I don't feel, I would never tell you I'm an allergy person or I'm a sinus person or anything. I mean, I don't have, I can breathe through my nose, but when I do the xylitol nasal spray, I'm suddenly like, wow, my head feels clearer. It's wonderful. I think it's a great product. I just don't have them stick the nozzle up the nose. Just missed it. and then sniff it up. It's much more comfortable that way.
And that helps you breathe better through your nose.
Yeah, and I do it before I go to bed at night more than I do any other time.
I recommend it to most like mothers who have little kids. I mean, these kids are all stuffed up. They're clogged up constantly and they're always breathing through their mouth. That's the first line of defense. I go, something I call nasal hygienes.
Yeah.
And a xylitol nasal mist is part of that system. And some kids are even junkier than others. So then we're like, hey, you might have to do an actual nasal syringe with salt water and actually do some sort of a neti pot with these kids. And it'll start opening them up. And then all of a sudden they're breathing through the nose, not through their mouth. Decay, no longer a problem. They're effectively breathing better at night. They're sleeping better. They have more energy throughout the day. So like, that's what I always start with is nasal hygiene.
Absolutely. And I'd like to add that they've got studies from World War II that when you use xylitol to clear the mouth or the nose, kids get 43% less chance of an middle ear infection.
Yeah, makes
My
sense.
kids never had a middle ear infection.
Will they listen better too to instructions with their ears?
You try it. If they do, it's only a short term.
Let me ask a question and push back on the sparkling water. I know acid dissolves enamel. Mm-hmm. What if the rest of their diet's on point? They do the topical fluoride. Could sparkling water be their one vice?
No, they should have more than one vice. I mean, have multiple vices. Have at it. If your diet's protective enough where you're not having any issues, then I don't want to rock. If they're doing sparkling water and everything's highly mineralized and everything's great, have at it.
Okay.
And I would add that it's the timing of these things. You know, if we understand the circadian rhythm of saliva, it's best in the afternoon. If you mess up that mouth resting time in the afternoon, you lose the most valuable time for your teeth. So if you're going to sip sparkling water, don't do it in the afternoon. Maybe you do it in the morning. Maybe you do it late night instead. I mean, I know a lot of people giving up alcohol now, so you want to sip something. Do it for a reasonable period of time. I mean, what is a reasonable period of time? Half an hour, and then be done with it. I actually put pomegranate juice in sparkling water. It makes a wonderful drink.
Please bring up the study you just read about the pomegranate juice and the bacteria, the pomegranates.
Oh, yeah. Well, the whole thing is pomegranate, I think. I don't want to advertise this too wildly because I think if people really understood the power of pomegranate, we'll be out of pomegranates. Because
sure.
Dr. William Lee, who is the nutritional guy that I have done some podcasts with, and I think he's absolutely wonderful. He's got books out there. He's got immunotherapies that he has created for patients with cancer. And in studying one of these, he had a cohort that included his mother. She was stage 4 cancer, and all this cohort were, and he was trying this particular immunotherapy. And fortunately for him, his mother was part of the 20% that didn't just get a bit better, they went into complete remission with his immunotherapy. But the other 80% of his cohort died. Nobody got somewhat better. They either totally recovered or didn't. And so Dr. William Lee was very smart in thinking, let's do a gut bacterial analysis and see what's the difference between these people, 20% completely well and the 80% that died. And he found that there's one bacterium called Akkermansia. And it's very foundational. It's involved with butyrate, I think, as well. But I don't know all the ins and outs of it. But I think, and you can't take a probiotic. Now, of course, people are marketing Akkermansia probiotics. You have to generate it. It has to form by itself in your gut to be strong. And pomegranate is one of the absolute best foods for that and also for stem cells. So I start my day every day with either the BioGaia Immune Health probiotics if I'm about to take a trip or, I mean, I'm never sick, so I don't worry about that. But if I'm flying in a plane, especially for long distance, I think we can be affected by that. So I take it for a week before and a few days afterwards, just as protection. But I also, every morning, will start with some pomegranate juice and a little bit of kefir. I say that wrong, don't I? But however you
Sounds
say
right
it,
to
but
me. Yeah.
it's probiotic
Yeah.
in yogurts or kefir, or you take it as a pill. But pomegranate is unique. Pomegranate is special.
I think that's a good segue because patients are sometimes afraid of fruit. You mentioned this yesterday because of the sugar.
Mm-hmm.
And definitely a whole food fruit isn't bad for your microbiome.
Well, again, when you're saying it's bad for you, is it bad for your teeth?
I think they're afraid that the sugar feeds the bacteria in your mouth and that causes the cavities.
So you end the meal with a tooth protective food. It's meal planning, timing, patterning. What's the word we want to use? But it's, if you end the meal with a toffee pie and a coffee, you've got acidity, sugar, sticky, worst thing you can. If you end the meal with some avocado or strawberry or raspberry that naturally contain xylitol, or cheese, which is karyostatic. There are lots of different foods. An apple, actually, with a fiber.
It's what's interesting is the word sugar has been demonized.
Yes.
In this country particularly. You say sugar, they lose their minds. Every fruit has sugar in it. And just the word sugar, they freak out. But there's like fluoride, there's different types of fluorides, different types of sugars. And again, nature is not going to create a fruit that was designed for animals to eat and all their teeth fall out. It just, come on. So eating fruit is, and interesting enough, I actually had patients do me a favor, take your toothbrush, brush the left side of your mouth, and then take an apple, cut it, and brush the right side of your mouth. The right side's actually going to be way cleaner feeling. An apple a day keeps the doctor dentist away. That apple has fiber, has malic acid, has sugar, has everything you need is in that thing. You don't have to rinse your mouth. No offense, you don't need xylitol after that because it already has everything you need in it. But if you take that apple and make it into apple juice, now you got a sugar problem because you have processed that apple. It's no longer an apple. So you've talked about it multiple times. Processed food is what causes majority of our problems. But people don't understand what processing is.
No, and I mean, those crackers, the goldfish.
Oh no, so those things are like paid for probably, my house, my car, my everything. Like I tell
but
people
think they're cheesy, and cheese is good for teeth, right? And it's true. Cheese is good for teeth, but those little crackers are just carbohydrates that melt down and get stuck.
It's a tooth decay nuclear bomb is what I tell people. And they give it to these kids early on. And they're addicted to it. These little kids, you put them a little Ziploc bag of goldfish and you basically got a happy kid. But then as a dentist, I know I'm like, cha-ching, cha-ching, cha-ching. And I'm not doing it out of like a comedy. It's like, these things are just straight cavities.
So if your kid is addicted to it, as a mom and a grandma would say, eat whatever you want to eat, drink some water at the end or some milk, and then have some xylitol, because it's easier for them to create a pattern of understanding with that. And the same thing when kids brush their teeth at night. I'm all for kids practicing, having fun, trying to brush their teeth, but you can't brush bacteria away. But you can give your kid a couple of xylitol mints right as they're having story time. And then they're going to shut their mouth and go to sleep. And for the nighttime, the xylitol is going to be feeding the good bacteria in their mouths. That's a super time to have xylitol.
It's tough because parents have a million things they have to add to their repertoire already.
Kids will remember that.
I mean, I think it's a good thing, but for me, I always tell these parents, I'm like, you just have to start them on good habits. If you're going to give them the goldfish, they're going to be addicted they're going to love that over apples. So if you just try to avoid those things and get them into the good habits of eating natural whole carrots. When I was a kid, it was carrots and celery. And every now and then, if it was a sweet treat, I'd get peanut butter with raisins. It was ants on a log, I think my mom called it, And that was my sweet treat. I'm like, ooh, ants on a log. And that was amazing to me. I never got the goldfish in the tortillas and whatever. I never got that because even though my mom was from India, she knew that wasn't food. No one had to tell her that. She had the sense to know that's not food. I'm not going to give that to my kid. So I think parents have to take some responsibility here, and they have to, really make good decisions. They know what the decisions are that are good, but I don't know. I'm not a parent. But then they're like, I should hook them up somehow with this other thing. And once you start,
Well, and yeah,
you know?
I mean, and the thing is, when the kids, you've got to try to train them so when they go off in life, they're going to make better choices.
A good anecdote from my personal life is we spend a lot of time on Lake Huron, which is in Michigan in the summertime. And when my kids are outside in natural sunlight and their feet are on the sand on the beach, they are not begging for snacks all day.
How interesting.
I think if you get kids out of the artificial light, away from the TV, they're not dopamine driven. If you get them actually touching the ground in nature, my kids, they don't eat all day because they're outside in the water getting nourishment from the sun. And I really think the artificial light has a lot to play into with the snacking as well.
Well, especially if it's making your saliva drier and more acidic.
Yeah.
How interesting.
And it's very, I mean, I have an 8-year-old, a 6-year-old, and my twins are 4. I can barely teach myself habits. It's impossible to teach a 4-year-old habits. But if you put them in the right environment where they're not begging for this high sugary food and they're outside in the sun, then the habits kind of form themselves.
Mm-hmm. Cool. Except they'll go to school and be told they need to be drinking water out of a water bottle.
One small win at a time.
So we're just saying that we've talked for quite a long time. It'd be divided up, I'm sure, into little segments, but it is a lot of information and it's all very good and wonderful. But what's the real take home, say, Vince? What do you think can help people the most to learn from what we've spoken about today?
I think if patients take responsibility and then they no longer view their dentist or doctor as the high priest, but they view them as a partner on their journey to health. And if you can ask your dentist why things are happening and actually discover the truth together, in the long term, you'll be healthier and your doctor will be happier because he's healing you.
I think that's great. I think that's wonderful. Absolutely wonderful. You obviously agree,
of
right?
Course.
But
I mean, and
what will you add to that?
I think it's important to people always ask the question, why? Why is this happening? Why do I have this? There's always a root cause to everything the body is exhibiting, always. So your doctor has to be a Sherlock Holmes to figure it out. In order to be a Sherlock Holmes, that doctor has to also ask, why? And if you don't know, go find out. The answers are all there. They've always been there since time began. The information is there. So I think for people to choose a doctor, and if what I'm saying aligns with what you also want for yourself, then go find a doctor, because there's doctors out there who are like this. We may not be a dime a dozen. We're not super common, but the point is you have to always ask the question why. It's really, really important. And if you don't get that question answered, then find someone who can answer it for you.
Yeah. Well, I would go as far as to say, why do I need that filling done now? Can I wait 6 months? Can I try Dr. Ellie's program for 6 months? And if you said to me, if you were a caring dentist, you'd say, well, yeah, I've never seen a cavity reverse, but why don't you try it? Why don't I just take a look at it in 3 months and see how you're doing? Be positive about it, right? I mean, these people have so much drama in some of these offices when they want to delay something and try a new approach. But I'm with you in that you have to understand why that happened in the first place. Because you can try and reverse gum recession that's caused by Invisalign, putting your teeth out of balance. It's not going to reverse.
No. Why are they? I mean, there's other reasons for recession. So it's really important to understand the whys before we come up with the hows. And patients have that right to ask. I mean, that's one point I like people to understand is doctors sit on their high horse, and oftentimes they feel maybe it's ego, whatever it is. But a lot of people are hesitant to question their authority. And you know what? I say question it all day, every day. If you do not feel comfortable, question it.
Well, and hygienists too. I won't get you started on the topic of hygiene, but hygienists are pretty authoritative sometimes.
They're scary at times.
And it's hard to fight that. I mean, people feel very intimidated, I know. But that's, again, where I wrote my book. This last one is my legacy book because I'm not writing anymore. But really to try and educate people, to empower them.
Exactly.
So that they'll know what the questions to ask. Go with a piece of paper. Write down what were those numbers you were just calling out? Or I've got a 6, and where is that 6?
Yeah.
Show me so I can go brush it.
And what does it mean?
Yeah.
What do those numbers mean? What am I supposed to have? What shouldn't I have? I think people should ask more questions instead of just accepting it as is, because the more you're educated as a public, the better decisions you can make.
You can find me at the Dr. Vince Buscemi podcast and Dr. Vince DDS on TikTok and Instagram.
And you can find me at Truth DDS on TikTok. Also, my website, honestfamilydental.com. I'm here for you.
And I think the best resource I have is the book Kiss Your Dentist Goodbye, which is available on Amazon. And my website, which is drellie.com, ELLIE.com.